Somaya Ranamagar got married when she was 18. She now has 2 children, a daughter and a son. While she was pregnant with her second child, the one she is now nursing, Somaya started to lose appetite. Then she began to lose weight, becoming thinner with every passing day. Later, Somaya developed a cough that would not stop. Like most people in rural Nepal, she became afraid she may have angered evil spirits, and she consulted a local shaman.
त्यो पन्छार मात्रै लाग्छ नि त्यो औषधि पनि त त्यसरी हेराउनु पाए अनि त्यहाँरी होला गरेर आउनु हुन्छ भन्ने कुरा हो हाम्रो है यहाँको पन्छाइदिनु पाए उहाँको औषधि त्यहाँ पो लाग्छ भन्ने सुरले यहाँ जहाँ आयो त्यहाँ त अनि देखाइदिन्छ अनि यही औषधि गर्दै गर्दै हुन्छ फेरि
But Somaya did not get better. Eventually, she was taken to a hospital where she was diagnosed as having tuberculosis. She is now taking medication.
पहिला भन्दा धेरै फाइदा पहिला दुखिरहन्थ्यो ज्वरो आइरहन्थ्यो
कहाँ दुख्थ्यो
पेटै दुखिरहने ज्वरो आइरहने ज्वरो चाहिँ कहिले न उतिखेरै पसिना आउने ज्वरो रहन्न
खोकी
खोकी लाग्थ्यो अहिले खोकी लाग्न लाग्छ हल्का लाग्छ
Somaya is one of Nepal's estimated 44,000 people who develop tuberculosis every year. Of these, about 11,000 die. If diarrhea is the major killer of children under 5 years, TB is the major killer disease of the adult population in Nepal. On average, 60 out of every 100 adults are infected by the TB bacteria. Efforts to control TB have been underway for several decades. But the disease remains a major health problem in developing countries. In 1993, the World Health Organization declared an emergency and recommended a new strategy for controlling tuberculosis. The Directly Observed Treatment Short Course, or DOTS, is the strategy recommended by WHO. DOTS is now being implemented in many countries. The National Tuberculosis Program introduced DOTS in Nepal in 1996.
Basically, in Nepal, tuberculosis is a big problem. So we implemented directly observed treatment short course chemotherapy in 35 districts. And with this result, we covered 33% of the population. And after that, after implementation of directly observed treatment short course chemotherapy, we achieved 100% target. So it means we cured 85% cure rate. So this is the very, very good result, not only in the Nepal, in Southeast Asia as well as in the world also.
DOTS requires the patient to take medication regularly while being observed by a health worker every day for 2 months. These 2 months are very crucial because if the patient does not take medicines regularly, drug-resistant tuberculosis can develop. Thus, health workers have to ensure that each patient swallows every pill every day. In Nepal, TB patients are mostly treated as outpatients. Before DOTS was introduced, people with tuberculosis had to take medicines regularly for 12 months. Under DOTS, the time one needs to take medicine has been shortened to 8 months, including the initial 2 months under direct supervision by health workers. This strategy was introduced to ensure that the patients do not discontinue medication. Nepal has a very rugged, steep topography. Travel from one place to another can be a nightmare, especially in areas inaccessible to motorized transport. Even where motor vehicles are available, the high cost of transport forces many people to walk over long distances. Transport is not easy, even in the relatively flat, narrow strip of plains in the country's south. Travel conditions become even more difficult during the rainy season. These geographical factors often make it difficult for TB patients to participate in DOTS at existing healthcare facilities.
बस्नु नमस्कार त हिजो भन्दा त आज ढिलो आउनु त आउनुहुन्छ भन्दै थिएँ मैले
48-year-old Tara Bahadur began his TB treatment 2 weeks ago. He visits the female community health volunteer in Damauli for medicines every day. As a participant in the DOTS treatment method, he has to take these medicines under direct supervision by the health volunteer.
यो दबाई नखाइन्जेल त अब म बाँच्छु जस्तो लाग्दैन 2-3 दिन खाँदा नि के होला जस्तो लाग्यो खाँदै जाँदा बेसी हुन्छ भने पनि बेसी हुँदै गयो
कहिलेदेखि चाहिँ अब बाँच्छु जस्तो लाग्यो त कति दिनपछि
त्यसलाई 8-9 दिन बसी धेरै बेसी भइहाल्यो नि हिँड्न पनि बजारतिर जान पनि भयो
Tara Bahadur does not live in Damauli. It takes 8 hours of walking for him to travel from his home village to this township. He now lives with his sister in Damauli to ensure that he can take his medicines under the direct supervision by a community health volunteer. Implementing DOTS in the far-flung villages is a very difficult task. Many of the healthcare facilities are often too far away from the patients' homes. In some hilly areas of Nepal, female community health volunteers, FCHV, have been mobilized as treatment supervisors for DOTS. Nani Maya is one such volunteer.
मैले औषधि खुवाएको चाहिँ 3 जनालाई है 4 जनालाई औषधि खुवाएँ अहिले औषधि खाने 2 जना हुन् एउटाको चाहिँ यस्तो घाँटीतिर पोका थियो के गाँठी टिबी अनि त्यहाँ लग्यो अनि टिबी हैन म त जान्न भने थियो है त्यो केटाले अनि यस्तो गाँठी टिबी नि हुँदो रहेछ है गाँठा थियो के गलातिर जम्मै गाँठा थियो त्यो औषधि खाँदै गएपछि त्यो गाँठा हरायो है त्यो गाँठा हराएपछि उसलाई कहिले फुल्नी कहिले कस्तो नि हुने के मोटा हो कि भने के सबैले यो भिटामिन खाएर मोटा आयो फुल सधैँ खानी त्यसो भएर टिबीको औषधि खापे अहिले मोटा भनेको सुन्निएको रहेछ अहिले त ठीक भएर उता इन्डिया जाहिर खान गइसक्यो
She has been administering medicines to many patients at her home. Nani Maya's responsibility is to administer medicines and keep track of patients she serves. Such volunteers serve the villagers without being paid.
सबैको स्वास्थ्य राम्रो हो सेवा अब पहिलेदेखि गरेको काम भनेर गरिया हो सेवाको लागि अब धर्म हुन्छ गाउँमा धर्म हुन्छ भन्छन्
Community health volunteers such as Nani Maya have to ensure that they have an adequate supply of medicines. They obtain medicines from the health center every week. Ensuring that medicines are always available at health centers is crucial to DOTS. A timely supply of medicine is critical if the efforts of the health workers in remote villages are to be successful. All medicines needed for the treatment of tuberculosis in Nepal are sent from the National Tuberculosis Center. From here, the medicines are sent to the regional medical storehouses. The regional medical stores record the supply and forward them to the district health offices. The district offices distribute the medicines to the health centers and to the health posts. The patients get their medicines from the health centers and from the health posts. Crucial to tuberculosis control is the quality of the medicines that are supplied. Regular inspection of medicines are carried out to ensure adequate supply and quality of the drugs. Tuberculosis can be of different types. The tuberculosis bacteria can infect many organs. Pulmonary tuberculosis, or lung TB, is most dangerous in terms of public health. This type of TB can be transmitted easily as the bacteria is released into the air when patients cough or spit. The diagnostic part of lung TB is relatively simple. The most effective way to identify pulmonary TB is by examining the sputum smear using microscopes. 3 sputum samples are collected, prepared on glass slides, stained properly, and examined by trained technicians. Sputum examination is important not only for diagnosis but also for the assessment of treatment. The plains in Nepal's south are relatively more accessible than the hilly areas of the country. On casual observation, this health post building in Makar does not look capable of administering dots, but it serves as many patients as a big hospital would. Out of 40,000 people living in this area, this health post serves about 12,000 patients every year. Among them are 51 tuberculosis patients who come here for dots every day. Health posts, such as this one, can play a major role in public health care in Nepal. While the physical facilities here are very modest, this health post has all the components needed for successful implementation of dots.
र हाम्रो क्युर रेट भनेको त्यो अवधिको 87% छ र यो हुनुमा स्टाफको कमिटमेन्ट सुरुमै बिरामीसितको काउन्सिलिङ र कम्युनिटीको इन्भल्भमेन्ट नै हो जस्तो मलाई लाग्छ र भविष्यमा क्युर रेट अझ बढ्ने आशा मैले राखेको छु।
Fatuma Khatum moved and settled here 12 years ago. She is 35 years old and has 4 children. Her husband has remarried and lives with his second wife. Like many Nepali women, Fatuma is poorly educated and doesn't understand the importance of TB treatment. In Nepal, there is also a stigma associated with tuberculosis, which discourages people from coming forward for diagnosis and treatment. Fatuma's illness was diagnosed 2 months ago and she is now under treatment. She has been feeling better since she started medication. Sometimes she does not come for her medicines. One reason why she is not willing to make the long walk to the health post is that she does not fully believe that she has TB.
टिभी पहिला पहिला कस्तो मान्छेलाई लाग्थ्यो भने जस्तो लाग्थ्यो भने जाँड रक्सी नखाने मान्छेलाई पक्कै पनि लाग्दैन जस्तो लाग्थ्यो मलाई मलाई नै मैले नखाने मान्छे मलाई नै लाग्यो यो केबाट लाग्छ अब त्यो पत्ता लगाउन सकिएन
TB can affect anyone. It can affect the rich and poor, smokers and non-smokers, those who drink alcohol and those who don't, the healthy and the unhealthy. However, a large majority of people in Nepal continue to associate the disease with heavy drinking and smoking. What many don't realize is that tuberculosis is curable, and it is not transmitted once people begin taking medicines regularly. Community involvement is important in tuberculosis control. Joint efforts of community groups, health workers, and the general public can play important roles in reducing the misunderstandings that exist and motivating people to seek and continue treatment. These workshops and meetings address problems and achievements in a participatory manner in order to improve performance of DOTS implementation in the community. At this meeting, the health workers are explaining DOTS to the community representatives. On return to their villages, these local representatives can encourage suspected tuberculosis patients to seek diagnosis. They can also provide support to TB patients under treatment. Health education plays an important role in spreading awareness about TB. It can also help to increase acceptance of TB patients in communities. Street plays are a good media for dissemination of messages relating to TB control in the community. The plays help to take the message directly to the people. Adequate training for health workers and volunteers is also crucial for the effective implementation of DOTS. Regular training programs help to identify problems and also share successful experiences. Early diagnosis of TB is the surest path to total cure. This explains the project's focus on training laboratory technicians. Such training can serve as forum to disseminate knowledge on more efficient laboratory methods. Training is also provided to local community volunteers. Such training programs allow volunteers to share successful experiences and problems encountered on the job.
हुने रहन्छ हामीले बिरामीलाई औषधि लिनको लागि पानी दिन पर्यो अनि औषधि सँगै दिन पर्यो र औषधि लिएको पनि हेर्न पर्यो
Assessing strategies and planning activities are important. Regular strategy and planning meetings are also held to discuss the achievement and problems in TB control. The head of this household would not have been alive today had it not been for DOTS. Balchandra Shrestha of Damoli would have died from tuberculosis if he had not sought and continued treatment.
म यो बाँच्न भन्दा मर्न नि खमा थिए मर्नै पा हुन्थ्यो भन्ने के केही गरे नसकेपछि के गर्ने खाने नहुने त्यसै अहिले म ठीक छु
Today, Balchandra is fully cured. He can now work like any other healthy member of the family. There is now happiness in the family again. Balchandra's disease diagnosed quite late. First he consulted a shaman, then sought treatment at a local pharmacy. However, once he was diagnosed as a TB patient, he took his medicines regularly. That is why he is still around today to play with his grandchild. He is also likely to be around for many more years to share his life's experiences.
हेल्पोस चाहिँ नै मान्नु पर्दो रहेछ यस्तो रहेछ हामीले सानो भनिन्थ्यो यो मान्नु पर्ने रहेछ भन्दा यो गाउँघरको यताउता मान्छेहरू त्यस्तो भयो भने मैले जाने भएछ भने त्यहीँ जाऊ भन्छु पठाइरहेको पनि छु कसैलाई
Balchandra's case is an example that TB can be cured. Today, he spends his time spreading the word on ways to seek effective treatment. He is living proof that DOTS works.
We have just shown how DOTS is carried out in Nepal. Diagnostics, treatment, and trained manpower are all available here. But we have found a gap between the TB patients and healthcare services. Not only the geographical distance to the treatment services, but also the community's attitude toward patients sometimes make it difficult for the TB patients to complete the treatment. To control TB in Nepal, we still need to explore the most suitable way to apply DOTS services to those suffering from tuberculosis.
It has been proved that DOTS is an effective way to cure tuberculosis. DOTS can work with existing healthcare facilities in Nepal. One of the most important factors in implementing DOTS is the human partnership between the patient and the healthcare provider. A TB patient's desire to cure the disease has to come first, and the commitment to DOTS by the healthcare workers is essential. This partnership must be fostered, and this is where community involvement is needed. With the understanding and support from the community, the treatment of TB patients can be successful.